Hello everybody, this is Pramit Karmakar and you're watching News Mantra Live. The global pandemic of COVID-19 has now impacted almost all sectors of the society. But have you ever thought how the children, their health got affected by this viral disease? We at News Mantra tried to seek answers. We talked to Mr. Saurav Bhattacharjee, who is a nutrition specialist working at UNICEF Odisha, and tried to find out the answers. Welcome Mr. Bhattacharjee to News Mantra Live. Mr. Bhattacharjee, do you see any link of COVID-19 lockdown and children?
I agree that it has an impact. It has actually upended the lives for families around the world. Although essential items are still available, there have been panic buyings, there have been disruptions to the food system, means that some of the foods which was earlier available, some of the nutritious foods which were available for improving the health, nutrition and immunity of the children and the families are no longer available. They are difficult to find. For many people, unemployment and lost income will make food purchase an additional financial challenge. Recently, there has been a joint statement by the Indian Public Health Association, Indian Academy of Preventive and Social Medicine and Indian Academy of Epidemiologists, and I would just like to quote this statement. Across the country, the mortality attributable to the lockdown itself, primarily because of the total shutdown of health services and livelihood disruption of nearly the entire bottom half of the Indian population, may overtake lives saved due to lockdown mediated slowing of COVID-19 progression. So the situation is pretty grave at this point in time. In Odisha, we have seen between the two national family health surveys that the prevalence of wasting, which is about severe acute malnutrition, the children who are very highly malnourished and are more severe among those other children, their proportion has actually increased from 19.5 to around 20.4% between NFHS 3 and NFHS 4. Which in effect means that their condition will get further aggravated if this situation continues, if they don't have access to proper treatment and nutritious care.
When we talk about the social and health indicators, government surveys like National Family Health Survey and Census hinted that Odisha has shown progress with time. Do you think that this can have a setback now?
Because Odisha, as all of us know, it is the 11th largest state in India with a large rural population, with scheduled tribes constituting, as I mentioned, 23% and scheduled castes around 17%. But over the last 10 years, we have seen that there has been a good decline in the prevalence of stunting, which is chronic, and hence the malnutrition, which is more difficult to address. It has actually come down from 45% in 2005-2006 to 34.1% in 2015-2016, which is a reduction of around 24.2% over the last 10 years. So, in terms of the annual rate of reduction, Odisha is performing much better than the state average. The annual rate of reduction in Odisha is 2.73, which is higher than the national, which is at around 2.2. Similarly, other indicators, nutrition indicators, which has a profound impact on childhood stunting or malnutrition as a whole. For example, the early and exclusive breastfeeding rates. So, breastfeeding within 1 hour of birth, which is the early initiation of breastfeeding, has actually improved from 25% in 2005-2006 to 52. By around 25% it has improved. So, the figure was 55% in 2005-2006 and in 2015-2016 it is 68.6. Exclusive breastfeeding has also risen by 29%. So, these clearly shows that there has been a lot of improvement. However, there is one area which is a concern for all of us, and everyone including the government also acknowledges it, is about the quality of complementary foods, which is the additional food which the young child requires for its growth and development. That proportion, just like other states of the country, has actually not shown a great improvement over the NFHS. And this is an area, again, because of the COVID-19 lockdown, access to nutritious foods are being limited, not for the general population, and more so for the vulnerable population. So I feel that if this situation continues and if there is no adequate steps taken in this direction, then there may be a chance that the stunting and wasting and other forms of malnutrition can increase, specifically for young children and women as well.
Which section of the society do you think was most hit by the lockdown curves and COVID 19? And what future do you see for those communities?
Obviously, as we see from various live TV shows, interviews, newscasts, it is the more vulnerable among the population, the more vulnerable among us who have been affected badly in terms of their nutritional status, because they were already at a vulnerable situation. Um, for example, in Odisha, if you just take the case of Odisha, 23% of Odisha's population belong to the tribal, our tribal population, and there are also a sizable SC population. Then there are population which because of the civil strife affected areas, they are still reaching services to those pockets continue to be a big challenge. There are also communities which are living far off, which are geographically excluded, and it is very difficult to reach services. So in light of this lockdown, where economic activities have been really stopped, people have not been able to do their livelihoods, practice their livelihoods. These are the kind of people who definitely have got affected more than the general population.
How UNICEF is working to minimize the impact of lockdown and COVID 19 among the kids and women?
Lockdown actually prevented people from coming together, but nevertheless, it required a very fast response. It required surveillance. It required frontline functionaries moving at a fast pace, knowing exactly what to do. And thus, it required a huge amount of training without um, physical presence and physical contact. So, that presented a kind of a challenge as well as an opportunity for UNICEF. We kind of worked with a couple of online platforms wherein we managed to actually reach almost all the frontline functionaries of the various departments that we work with. For example, through a TOT, training of trainers approach, first of all, at the headquarter level in Delhi, we developed a module. Very quickly, we developed a module and got it translated into the state language Odia, in terms of what are those key messages which needs to be given to the frontline functionaries for addressing this situation, when they are going out, what precautions they need to take. When people are coming in, what are those measures that we need to take to ensure that there is no stigma and discrimination. Then we kind of adapted it to the state, and we used the online training platform, and we reached all the Anganwadi workers, 71,000 Anganwadi workers, all the ANMs, which is close to around 15,000 I believe, all the ASHA workers. Then we have also reached around 7,500 gram panchayats, which is all the gram panchayats across the state, with messages on nutrition, health and wash, with a particular focus on women and children.